Hello, everyone. Happy August. Welcome to August office hours. Can folks hear me okay?
Yep.
Great. Can you see the screen?
Yep.
Wonderful. Well, thank you for joining today. And as always, this is being recorded and we'll have it up on our AHI website in the near future. And as always, we have the chat function for folks for along the way if you have questions, and please ask if you have questions as well or anything you want to discuss. And we will get started. So we have policy and procedure updates. We're going to have some quality management, performance, compliance updates, NetSmart, some referral discussion, children's program updates, and touch on some upcoming trainings as well, and some other things that we wanted to touch on for folks. But first, I wanted to have a big welcome. We have a new staff on the lead side. For those of you who knew Courtney Palmer, who had left us a few months back, we have a new person that just started yesterday. Her name's Caitlin Bear. She's a new on the lead side for revenue and referral specialist. So you'll be seeing and hearing more of her as time goes on. She's going to start working in the lead side and getting up to speed here in the coming days and weeks. So we'll start to get some correspondence from her and talk with her and get to know her as we move forward. So congratulations, Caitlin, and welcome aboard. So we're excited about that, and we look forward to working with Caitlin.
One more thing, Travis, before you get totally rolling,
yes.
I just wanted to ask if there's any folks that are called in, if you could just put your name and agency in the chat. That way we can give your agency credit for having participation on office hours. If you're logged in through your name or your agency email, then it's no problem. I get that on the participation roster and I can give you guys credit. But just if you're on with a phone number called in, just write that in there so we can make sure we attribute that to the appropriate agency. Thank you.
Thanks, Taylor. Appreciate that. And we want to get credit for those folks that are attending for sure. All right, so policy procedures. This month we have a comprehensive assessment update that we're going to review for the network. Upcoming policies in the future is children's HCBS waiver. We have a children's HCBS waiver service definition policy, continuity of care, HCBS palliative care, assignments and referrals, interpreter services, and eligibility and appropriateness criteria are all on the way in the coming months or month. Hopefully, a lot coming up forward though. Never ending for policies. So comprehensive assessment policy. So a lot of updates with this one. So mainly this one's going to have requirements that have to be documented in the person's record, obviously. So for UAS for children, it's going to identify locations within the health home system which are accessible for the Department of Health for redesignation purposes and other purposes as well. In particular for the consent for the DOH 5055 and 5201, you have to include all providers for reference through the comprehensive assessment. And you want to make sure the MCOs and behavioral health organizations are applicable, are going to be referenced for that as well. You want to make sure that all areas of the comprehensive assessment listed are assessed. If there's an area that a member does not want or is not able to provide responses to, you want to make sure that you note that within the case record. So if that person doesn't want to talk to it or respond to that, please make sure you note that so that that is referenced in the case note, that it's clear that that person doesn't want to address that or talk to it. And then just make efforts to collect information as much as possible around all topic areas of the comprehensive assessment, knowing that it is a sensitive document for folks, a lot of sensitive topics. And, you know, there's going to be some things that are going to be that you're going to go back to, and it's not going to be all at once that you're going to be touching on things at times. You may have to go, if it's a child or someone who's underage, you're going to have to go to things that are, to the parent, and you're going to have to go to the guardian to some things and talk to with them. And so keep that in perspective as well. Documentation verification for those things should be obtained from various sources. Looking at primary care, other team member psyches, which is spelled incorrectly on here, RIO, the Statewide Health Information Network, the SHINY, our managed care organization. So just wanted to pause to see if there's any feedback or comments thus far. Okay. So moving on. As of 3/4 of 25, the CANs and the comprehensive assessment were combined to become one assessment. So for health home policy, the comprehensive assessment and CANs can be used interchangeably for children's health home. So that was a nice change. So that's incorporated into policy now for the comp assessment policy. So AHI policy, each enrolled health home member receives a comprehensive assessment within the 56 calendar days of enrollment and at least annually thereafter. The health home comprehensive assessment will inform the development of the plan of care. That's always been the case. Now it's changed to 56 days via Department of Health. Now it's a mandatory functional approach for information collection as well as ongoing dynamic process of information gathering. So you want to make sure for healthcare need related needs for that person for full integrated plan of care. Again, that's stuff that you already know, but we just wanted to touch on that as we're going through this review. Some things that we want to keep in mind for the comp assessment as well. It's a screening tool that you're evaluating risk of behavior for the member, so that you're looking at the overall health and well-being for that individual when you're going through this assessment. It's a detailed description of the person's medical and behavioral health, their mental health and substance use, as well as psychosocial conditions and needs. Other things to keep in mind is an assessment of social determinants of health, including their lifestyle behaviors, social environment, their health literacy, their communication skills, what care coordination needs, their entitlement and benefit eligibility and recertification needs as well. Other things to look at as you're going through this document: self-management skills, their functional ability, such as thinking and planning, sociability and coping skills for the individual, their activity and interests, and then what are the strengths and support system needs and resources for that person as you're working with them going through this document. So I just wanted to stop again and see if there's anything anybody had for questions or thoughts as we're just touching on these points. Okay, keep moving on. For health home members that are children, just wanted to point out that as part of the children's program, it's the Kansas House and the UAS, as folks know that are in the children's health home. It's a children's model for acuity. It's going to be for 21 behavioral health needs, medical needs, developmental disabilities, juvenile justice involvement. And it's also going to serve as tools used to collect the majority of information for the comp assessment for those enrolled in children's health home for southern children. And it's really going to help utilize that person-centered planning approach for the child, for the individual. And help to put together the community-based services for that child and anything that person might be eligible for. And to help to identify anything for children's waiver services or home community-based services for that person that might be risk for institutionalization, or someone who might be being discharged for institutionalization. So really, it's a good comprehensive assessment tool to help and assistance for all the coordination for those efforts and services. Just wanted to pause again and see if there's any thoughts or questions around any of this. Okay. Timelines. Again, the initial, it's got to be completed in 56 calendar days. And this is both for adults and children, and then at least annually thereafter. Multiple times it can be done over that time frame. It doesn't have to be done in one sitting or session. Again, there's a lot of sensitive information material in there. Folks have different tolerance levels for how they want that done or can tolerate having it done, depending on what they want to talk about or what they can tolerate being discussed. So, go at that person's ability level or cadence and wanting to do it. And then updated as needed or annually thereafter, or any significant medical or behavioral change along the way. And then any changes in their goals or service needs, you want to identify through the plan of care, obviously. And then touching along the lines of the CESS tool itself, that's going to be for anybody that's an adult. As folks know, that's conducted 12 months after the consent date for the adults, and then every 6 months thereafter. That's going for continued eligibility for services for adults, and that's going to be important and crucial for that member to continue in health home services. And then the CANS for the child is going to be annually from the date of last completion. And that's going to be part of that assessment and plan of care for that individual. So I wanted to pause again. Anybody had any questions, thoughts, anything along those lines for these pieces for the comp assessment? Okay. And then significant life events. If there's a life event that's of significance, medical or behavioral health, before the next review, you don't necessarily have to do a comprehensive assessment, but you should perform an abbreviated eval of that person's status, including a screening for risk factors. You should review and sign by a supervisor, and that goal or service should be reflected in the plan of care if there's a change in that for that individual. And go over that with that person's care team. And that should be reflected in a plan of care as well. That's be impacting that person. Anything with this for anybody?
Hi, Travis.
Yeah.
I just do have a question about the part of the many parts of the comp assessment. So
Yes.
it stated that at least one part of the comp assessment needs to be completed in person. So if we ran into a situation where we did much of it over the phone, does that mean that we could have much of the comp assessment over the phone and meet with them to say, complete the PON? Or how does that work? What does that look like?
Well, you have to meet with them at least once in person, and the rest can be
That's okay.
as that person's
Right.
wishes, basically.
For the front room,
Yeah,
we were one short
okay.
or whatever. And we were
somebody's-
also one of
Yeah.
the sign.
Jackie
short
Jackson?
that-
Yeah.
Well, Kirk went on vacation and never made that sign.
Oh, okay.
Jackie, I think you went off mute. So as long as you have one in person with the person through that process, the rest can be based on whatever's comfortable for that person and how they want to complete the assessment.
Okay.
So the
Travis, and
requirements-
then there was a question in the chat from Marcus, asking if there's been changes to the standard amount of drinks on a daily basis question in the comp assessment. And the answer to that, Marcus, is no. We just continue to ask that you just mark it the lowest amount possible if they are not drinking. And we know that that's an issue, but that's a standard assessment across New York State, so we can't change it.
Okay. Good questions. Any other questions or thoughts, comments around the comp assessment policy? All right, so that policy will be available on our website shortly, the updated version. I can also send that out with the slide deck when I send out the slide deck shortly, just so you have that, because the final PDF has been approved for the update. So I'll send that out to the network, and then it'll be available on the website soon as well. And the folks can have the version with the slide deck. And then if there's questions, of course, folks can reach out separately. So we'll move on to the comprehensive chart audit review. Taylor, were you taking this one?
Yep. All
Okay.
right, I just wanted to touch on a couple of items for our comprehensive chart audit review process. So there was an addition of a new Excel sheet that we started using at the beginning of this year. And it's the audit reconciliation Excel sheet. So that will be sent to your CMA along with your chart audit results. Those will be in a zip folder with your scoring tool, your quality notebook for that month, and then this audit reconciliation Excel sheet. It is your responsibility to review your audits and return the Excel sheet prior to the audit review meeting with the health home. This has not been something that we've been strict on in the past, but it really kind of keeps us from providing all the feedback that we'd like to when CMAs don't review their chart audits prior to the meeting. And we don't have time to fully research any issues that they do bring to the meeting while we're actually in that meeting. So it's super important that you collect your data. If you have any refutes to any of the questions that you've gotten marked off on, you provide that on the tool and send that back to us prior to the meeting, and then we'd be more than happy to, and we look at that and provide any points back as necessary. We really like when you guys take a deep dive into these audits and take a look at it. It means that you understand what the question's asking, and you're taking a deep dive yourself into the chart. So we really want you guys to do this, and we encourage you guys to do this. It's just important that we have it back prior to the meeting so that we have a chance to look things over and award points back as necessary. And then in addition to that, on your scoring tool, there are items that will be highlighted in yellow, and they will have a yes in the column that's marked requires resolution. And it will have a date in the date field. It'll say prior to your meeting with the health home. You guys are responsible for reconciling those audit items as well that are on the scoring tool prior to the meeting, unless you've asked for prior approval for an extension, which would be happy to grant under certain circumstances. But again, this is something that we want to check into and make sure is completed prior to that meeting. And we run into issues where CMAs aren't looking at their results at all until we get to that meeting. And then we don't have that much to talk about because, folks haven't taken a look at and identified those issues that have been occurring. So if you want to go to the next slide, Travis, I think I have a screenshot of what it looks like just for those that don't know. Okay, so this is just an example of what the reconciliation template looks like. It has 2 sheets on it. The first sheet is for health home use only, so you don't have to do anything on that. The second sheet will ask you for the member's name, the care manager, SIN number, chart ID, and then there's a drop down for question number. So as you're going through your individual chart audits, you can select whatever question number that is, and it'll automatically populate the text in there for you, so you don't have to do that. You can just verify that that question number matches the question text. And then there will be a spot for you guys to write any notes. Again, this is for any questions that you might have. It can be something that you're unsure about, or it can be something that you just, you believe was marked off an error and you want to refute it. So just write in that other column what notes you have based on that specific question. Send this back to us prior to our meeting, and then we'd be more than happy to, again, review it and award any points back where necessary. And I think maybe I have another screenshot, but I'm not sure. I can't remember if I put the, okay, perfect. And this a screenshot of the scoring tool. So the scoring tool has been in place a little bit longer than the audit reconciliation template. But this is newer this year where you guys are actually getting specific feedback on the specific SIN numbers and what needs to be resolved. So this is just a snapshot of one specific SIN. So when you guys get your scoring tool back, the summary page is kind of a cumulative overview of all of your SIN numbers that got reviewed. And you'll see either a 0 or a 1 under each of the questions. 1 means you answered it correctly. 0 means it was incorrect. And if it's blank, it was an NA. And we didn't answer that question. We didn't award or deny points for that. And then along the bottom, you guys will see a whole bunch of tabs, and each tab has a SIN number assigned to it. When you click on that, this is what you'll see. It'll have the SIN number. It's blacked out on here, but it'll have the SIN number on the top left. It'll tell you the member status at the time of the audit. So this person was enrolled. If they were discharged, for example, there wouldn't really be anything to resolve on this page, but this person is enrolled. So they have certain things that are marked that, yes, they require resolution. So for example, question 4, are all the DOH forms completed correctly and updated in their entirety? Yes, that's something that's really important. If the state came in and audited us tomorrow, we would want that to be resolved so that we get credit. So that is something that we require resolution on when we see it incorrect on a chart audit. So that one is highlighted and it has that yes in the needs resolution column, which means that you guys need to resolve that item prior to the meeting with the health home. You can see underneath that there are other questions that don't necessarily require resolution, or maybe they can't have resolution. So 64, is there a monthly care manager note addressing the plan of care? That was one that was marked incorrect on this audit, but obviously we can't go back in time, right? So it's just something that moving forward, we do ask that you resolve and you start doing those care manager notes. And then same for question 73. Below that, if the member experienced an ED or inpatient event, did the care manager complete the appropriate follow-up? That was answered no on this chart audit, but again, we can't go back in time. So just moving forward, we're asking you to do that. So based on if it's something that requires immediate resolution or not, you'll see that yes versus moving forward, or if it's something like that needs to be included in the comp assessment, we might write that you resolve it at the next update. Some things we're not necessarily going to make you go in and resolve immediately, important like the DOH 50-55, something with consent, something with billing. Those are really important things that we will ask you to resolve prior to that meeting. But it should be pretty straightforward for you guys as far as what needs to be resolved, because again, it will be highlighted in yellow and you will have a yes in that needs resolution column. If anybody has any questions on the scoring tools or the audit reconciliation forms, please feel free to reach out to me either now or when you receive them, when you get your annual chart audit results. We're just trying to make this as streamlined and smooth as possible for you guys to get that feedback and for you guys to provide us with feedback as well, so we can ensure that we're all on the same page. Thanks, Travis. That was all I had on this.
Thank you, Taylor. All right, so folks might have seen this error not too long ago. Rose Close Pizza Boy, NetSmart. There was a note that came from our rep shortly thereafter saying that there was a solution that was unexpected, but they said that it was not a security compromise. This is the actual note that came from the rep, that an investigation looking into the matter, but it did not impact the full network. It was just in pockets throughout the region. They reached out to certain entities. So for those of you that did see this Rose Close Pizza Boy note, it was not a security compromise. It was a very brief window on this particular date and time. It was in the morning of August 13th, apparently. So I just wanted to note it to folks, if you did see it, talk about it, hear about it at the time. It did come to our attention as well. And we were also told it was not a security issue. So just wanted to note it to the network now, make people aware if you were hearing buzz about it after the fact. I don't know if anybody heard anything, but roads open. The smart's working again. Referrals. If your organization gets a referral for outreach engagement or an intention to enroll, just want to make sure that you're following the referral and assignments policy. And I know that folks generally do, but I just want to make the comment because we've had a couple instances where it hasn't happened. So just putting it out there as a general note to the network. So here's some highlights. 72 hours of discovery. The health home will notify the organization. The CMA is expected to reach out for adults within 7 calendar days of receiving a referral to make contact. If you can't support or you feel you can't meet the needs to support that member, please get back in touch with the lead health home to let us know so we can reach back out to that referral source or another organization so that we can close the loop. We've had some instances in more than one organization, and it has been a few in the last couple months where it's been a number of days past that 7-day time frame, and it's created issues with the referral source. It's been more than one referral source where we've had to mitigate as a result. So that's why I'm bringing this up. So please try and be mindful of that. We greatly appreciate it. And for children at the time, the timelines are a little bit different for children. We didn't write the policy. That's a DOH timeline. But under the age of 21, we got the Children's Health Home Referral Portal and Map. There's a 2 business day for receiving a referral to contact for receiving referrals. And there's a 48-hour practicality for, or as soon as practical for children. And the same thing, please reach back out to us if you don't think that there's an ability to communicate or connect. We really need to know that so that we can get back in touch with that referral source. I didn't know if there's any questions, comments that anybody had around this, but it's really important that the lead gets that communication if you're having difficulty. Taylor, anything we wanted to add that I didn't mention?
Just one thing, kind of related, just for folks to be aware, to utilize DataDen as a resource for you guys when you have members that are in outreach, or if the health home is putting them in for you for whatever circumstance, maybe your map's down or whatnot, and they put them in an assigned status. We just want to make sure, again, that those folks are being reached out to in an appropriate time frame. So if you go into your member quick list in DataDen, you will be able to see the date that those folks became attributed to you and what status they're in. So just ensuring that you're following these timelines, and that's a quick, easy snapshot for you to be able to see all the members attributed to your agency. So you can just make sure that your follow-up is within those timeframes.
Thanks, Taylor. And again, if you can't meet the time frame, if the 7 days is, I mean, if there's valid reasons and whatnot, I mean, we're definitely open and willing to work with you as an organization. It's not about not working with you. It's the communication piece. That's all. And most everyone is wonderful about it. It's just we've had a handful of instances come up where we need to talk about it to have a reminder. So we just want to be sensitive to it. So we appreciate it and thank you for your efforts. So moving on that vein, children's program updates. We just got notified from the Department of Health. Our redesignation for children's program for the lead health home is happening November 3rd through November 28th of this year. So it's going down. So as a result, we are starting to prepare now. So we're asking all of our children's providers, which is a good clip of our providers in our network, to start looking at your charts internally, please. I've included the link, and I'll also include the chart audit tool for children's when I send out to the network, because again, it's going to connect with a lot of our providers. The children's chart audit tool, please start taking a look, if you would, at your charts, start doing some spot audits, because we have no idea what the sampling is going to be that they pull when they pull the samples for the network. And then the other thing that they're going to do is they're going to have a focus on the IDT meetings. So please take a look at making sure that those are up to date, if you would. So start taking a look at that. So we're right now in the process of updating our preliminary documentation that they've requested of us to submit to them by September 5th is our first ask, or their first ask, I should say, of us. So we're getting that together now. And then 6 weeks out from the actual audit entrance, which would be as of the 3rd of November, they're going to ask for more information from us, which will start at that point to pull. So here we go. So we'll have more information out as we get it, but stay tuned. But here we go. Children's program redesignation. Any questions along the way, please feel free to reach out. Other children's program updates. Jessica's out. She went on vacation, well-deserved vacation this week. She just wanted us to highlight quickly, because I know she normally takes the children's highlights. She just wanted to make sure we mention HCBS Youth. It's on a statewide wait list currently. They need to be referred out to keep the referral warm, in quotes. If there's an MCO, the health home care manager should be communicating with to discuss the wait list. So that's an update there. High fidelity RAP expansion has been on pause. So OMH, more information to come from OMH on that pause. HCBS training in the US is it's going to be deployed sometime in 2026. And the annual eligibility screen and NetSmart for children will be available in 9/2. There'll be an option for initial or annual. And annual options are slightly different than the initial and appropriateness. So those are the updates on the children's front. Any questions, comments, thoughts for those updates?
Allison had a question in the chat. Don't we have the annual eligibility screen already? Yes, you do. Right now you use the same one for both, the initial and the annual for the kiddos. And it's pretty much going to stay the same. The only difference is similar to like the comprehensive assessment. When you do the initial versus annual, you'll just select annual if you're doing one that's an annual screening, and then there's a couple different options that will populate based on whether you've selected initial or annual. But it's going to be in the exact same spot, and it shouldn't be any different for your workflow. Just depending on what you select, initial or annual, you'll have different options to select, but same workflow applies.
All right. Any other questions on that? Okay. And then next slide, just some trainings I just sent out recently. So the MVP Health Home CMA Annual Education Presentation. This is one training MVP sent out on 2 separate dates. So just a clarification if that email was confusing at all. They're offering it on 2 separate dates. It's the same training. So the 15th and then again on the 29th. And then the second one is a training that's being provided, Power of Partnership, United Health Homes and Social Care Networks, the Whole Person Care, September 11th, 10 a.m. to 11:30. For those that are interested in checking that one out. So two options for folks if they're so interested that are coming up in the coming weeks. And that's all we had for today, unless anybody had anything else they wanted to talk about. Not, we won't hold you up for the rest of your day. As always, thank you for everything you all do each and every day, and hope you have a good long weekend coming up and enjoy the rest of your summer. Thank you all.
Thanks,
Thank you,
guys.
everybody.
Thank you.